couple days ago, I posted a video talking about auto brewery syndrome. And the reason I wanted to make that video is because I wanted to talk about not stereotyping or falling into that rabbit hole of we're treating all of our altered patients with it's just another drunk. I wanted to encourage casting a wide net. And with that, I want to talk about one of my favorite mnemonics, AEIOU tips. AEIOU tips is that mnemonic that we can use to cast a very large net of things that could be making our patients altered. Starting with A, we do want to look at alcohol, obviously, but we also want to think about arrhythmias or acidosis. When it comes to acidosis, something like CO2, our body does not like having high levels of, so we may become altered. When it comes to arrhythmias, something like torsades de pointes, those can actually cause seizures because of hypoxia to the brain. When it comes to E, we're going to talk about endocrine and electrolytes. Now, when you think of endocrine, I don't want you to think about diabetes just yet. I want you to think about thyroid problems, such as thyroid storm, Graves' disease, Hashimoto's, Addison's disease, Addisonian crisis. Those are the type of endocrine disorders that I want you to think about because those are the things that people may not remember or even consider. Just like acidosis, our body does not react well to having an electrolyte imbalance. So whether it's sodium, whether it's potassium, if something is off, our body is going to show signs of it. One of the things that may cause electrolytes to be off is our next subject, I, which we want to think about infection. This is where we might think about sepsis and how the high temperatures and high levels of infection may cause altered mental status. That's when we see like the UTI patients, which we'll talk about in a second. Next is O, which I want you to think about oxygen and overdoses. Oxygen, everyone knows this, the hypoxic craze. When we don't have good oxygen levels in our body, we will know, and our brain does not like not having oxygen whatsoever. Overdoses, I don't want you to think just about opiates. Now, opiates is one of our main overdoses, but I also want you to think about any other medication that we can overdose on, whether it's benzos or maybe THC, something like that, that may cause our patients to be altered. U, everyone knows this one, uremia or UTIs, those greenies that are just feisty and they are not very nice to you. They're altered because they're fighting a UTI. T, we can think about three things: trauma, toxins, and temperature. Trauma, we always want to consider a head injury. If someone's altered, if they're acting erratic, if they're asking repetitive questions, if they're really just not making sense, head injury should be really, really high on our list. When it comes to toxins, I want you to think, okay, is there anything in this person's environment that is making them altered? Whether it's the organophosphate overdoses, whether it's maybe something like carbon monoxide. Always consider everyone's surroundings when thinking about toxins. With I, we want to talk about insulin. We can now talk about the diabetic emergencies, okay? Hypoglycemia, cool and clammy, give them candy. This is where we give people dextrose. They may present with unresponsive, altered, just not really responding to you. One of the most common presentations that I see is my patients looking at me, but the lights are on, no one's home. They're not computing what I'm saying to them whatsoever. And then their blood sugar is like 30. Or vice versa, the hyperglycemic patients. These patients may present with lethargic, they're solemn, they're just not feeling good at all. P, we want to talk about psychiatric or poisoning. I already kind of talked about poisoning with the organophosphate overdoses when we mentioned toxins, but psychiatric, I always want to consider somebody maybe having a psychiatric emergency, whether it's a known problem for them or maybe it's a problem that they have had for a while, but they didn't know it was leading up to this now big behavioral problem, a psychiatric episode, a psychiatric emergency. So always consider that this could be a new onset for somebody. Younger people are more prone to maybe bipolar, schizophrenic, or manic episodes, but they may not know or catch those little symptoms leading up to these big episodes. And the last letter, S, we can talk about strokes, seizures, and syncope. With a stroke, you're not always going to have an unresponsive patient. Most of the time, my patients are actually looking up and talking to me, but they may not be saying the correct things. They may be having some difficulty with aphasia, where they're saying a word, but it's not really making sense. With a seizure, we always have that postictal state where people are either unresponsive for a little bit, they're really lethargic, or they're just really, really confused. And this is normal for postictal patients. However, if we have a patient that does not have a history of seizures, and this is not their normal, that can be an emergency. And syncope patients. Syncope patients, they passed out, they don't know why. Syncope in itself is a very, very wide net to cast when it comes to what caused you to pass out. But if a patient is just found unresponsive and we don't know what's going on, syncope is one of those things that we can consider. A very quick and brief rundown of one of my favorite mnemonics in EMS, AEIOU tips that we use for altered mental status patients. That is all. What other mnemonics do you want to see? and have a good shift.